Many times we see that even if with the normal lipid profile and particularly LDL cholesterol, patients come with heart attack or myocardial infarction. So there are some other factors which are responsible for a heart attack even if the cholesterol levels are normal, and more so at a younger age group less than 50 years of age. So if we consider the coronary arteries at the roads, then the LDL cholesterol is the number of passengers traveling in a car. You can say, imagine in two cars there are around 10 people who are traveling. So the risk is there, but risk of accident is lesser. But if the Apo B is high, that means the number of cars, each person is traveling in one car, so there are 10 cars on the road, so risk of accident is more, damage is more. So Apo B is high, the risk is more. The third is lipoprotein A. So instead of cars, there are much heavy vehicles on the road in large numbers, so the risk is still higher. So those people who have lipoprotein A higher in their blood, particularly younger people, and it is a genetic factor because lipoprotein A runs in family mostly, and if one member is having high, other members are apt to have lipoprotein A high. So every person once in a lifetime should at least get the lipoprotein A tested. And fourth is homocysteine. If the homocysteine levels are high, that means the road is damaged or corroded with potholes. Then there is HSCRP. If CRP is high, that means there is inflammation in the body, the roads are damaged, and the risk of accident is more. And the final sixth one is insulin resistance. If the insulin resistance is high or the fasting insulin is very high, that means there is a big congestion on the road and the risk of accident is high. So the risk of accident, in our case it is myocardial infarction or heart attack, is does not only depend on lipid profile and LDL cholesterol, also depends upon the other 5 factors which we should test and know. They are apoprotein B, lipoprotein A, then homocysteine, high sensitive C-reactive protein, and fasting insulin levels.